Okay, so we want to talk about how to help a patient who's struggling with paraplegia or bilateral lower extremity involvement, how we can help them move from a wheelchair to a bed. So eventually we hope that they can do this independently without help or assistive devices. But one option we have is using a sliding board. So when we look at a sliding board, there's different styles and different types, but usually there's a tapered end, so we can see that. That's the end that's going to go underneath the patient. So the other side would go against the surfaces, and the tapered end would be on the top end of it. And then oftentimes there's a hole to help the patient guide the placement, but once they have got the sliding board placed, we want to make sure that we remind the patient to not let their fingers get underneath here or underneath here, because as their body weight goes over the board, fingers get pinched. You only have to do it once to know how much it hurts. So we try to avoid that and caution the patient in that. So if our patient needs to move into bed, we'll always have to know what the makeup of their room is, how the best approach is going to be for them to get into their bed. So if we have a situation where the patient's bed we've got it lined up here, we line the patient up so that he is lined up along the edge of the bed, and now as he gets ready to get into bed, he'll take his feet off of his footrest so he can use a leg lifter, or leg lifter or his hands. He'll slide his footrests out of the way so that they're not going to be a barrier to him manipulating. And remember all the things that we already know about wheelchair. If he looked like he was going to fall forward, we would have him use that hook method to manipulate those things if that was a problem. But he looks pretty stable. So now he's got himself situated. So now we're going to move this armrest up and out of the way. And now Trevor, slide forward just a little bit. So the first method he's going to use to get in bed is using the sliding board with the foot down. When the feet are down, the most likely spot he's going to fall or move is going to be forward. So as the clinician, I need to stay in front of him. So we're going to reach over and grab this sliding board. And Trevor, what I want you to do is to lean over toward me. As you lean over toward me, we're going to slide that right securely underneath your hip. There we go. You can use this to push, but once you get it there, we're going to keep your hand flat on top. Once he's got his hand flat on top, now he's going to do little baby push-ups. We can help him, not on the end, yep, not on the end. We can help him to move over and slide, keep going. Little baby push-ups right up and onto the surface that he's going to. Once he's here, he can put the sliding board back in his wheelchair, so that's going to be handy for when he comes back into the wheelchair later. So think about what was the first thing on the bed. That's going to be the last thing off. So it's like a captain of a ship. The first man on is the captain, the last man off. So coming back to the wheelchair, we're going to do the reverse, and the last thing in the bed is the first thing out. So that was his feet. So the last thing in the bed was his feet. So he's going to start by bringing his feet over and slide forward. Slide feet this way. There we go. Now we'll reach over and grab his sliding board. You're going to grab it. There we go. We have it positioned so that it's over toward the surface. Can we slide underneath just a little bit more? There we go. Perfect. And now he's going to simply, watch your fingers, hands on top, slide down the sliding board. And there he is, back in his seat. Take the sliding board out, armrest back down, and we can put the footrest back in place. So this is one option with the feet down. The therapist stays in front of the patient because his feet are down. Now there's another option to doing the lateral approach with the feet up. So it changes things around just a little bit. With a feet up approach, he's still positioned the same. Armrest comes off the chair. he can reach over and grab the sliding board, slide it underneath, there we go. And now he's going to use the leg assist and put his legs up on the bed. There we go. Double check that everything still looks safe. Now, for my personal opinion, especially somebody who has shorter legs like our patient and myself, this is awkward. But now he's got the sliding board and he's going to use little push-up movements to slide up that sliding board and onto the bed. So for your patient, it doesn't matter which one you use for a lateral approach. It might be patient dependent on which works best for them and which they like better. So think about what was the first thing in. That was his feet. The last thing in was his hips. So when he comes back out, we're going to reverse. So just like we've done before, your feet need to go all the way to the middle of the bed. That should be over here in your wheelchair, friend. There we go. All right, slide your hips closer to me. Reach for your sliding board. Now Trevor is strong enough that eventually the progression is that he just moves himself over without the use of the sliding board. So this is just a bridge until he doesn't need to use that. But if he wasn't quite so strong, we'd slide that sliding board underneath, and now we're going to slide right down, little push-ups, over and across. And then move his feet back onto his footrest. This comes out. And this comes down. Our third option for a patient with paraplegia to get into bed does not involve the use of the sliding board. So again, we're talking about a person who is not going to do an upright position. This would be a person whose bedroom is going to allow them to make a front-on approach. So we're going to undo your, and Trevor, you already know how to do this because it's the same procedure we used with the bathtub. So he's going to roll up to his surface, get as close as he can, lock your brakes. If he can, he's going to take his feet and put them up on the edge of the bed. Pretty close. Slide the footrest out of the way. And now unlock your brakes. Slide yourself forward. As he goes forward, this is going to put quite a stretch on his hamstrings, and watch, sometimes the wheelchair wants to do a little bit, wants to do a little bit of tipping, so we have to be mindful of that. So keep sliding forward. There we go. Get as close as you can, lock your brakes. His feet are up, so the therapist should be behind. And now, depending on where his pillow is in the bed or where he wants to lay down, we can position his legs, but he's going to use his upper body to lift himself and move forward. And as the therapist, we just help the patient as much as they need. Please don't make your patient struggle. If your patient is having issues, then give them that little boost, whatever it is that they need. Don't make them struggle. Okay, last thing in the bed was his bottom or his hips. That's the first thing out. So he's going to reverse, back it up. Unlock the wheelchair. Go back away safely. Lock the brakes. Slide the footrest back in place. Put your legs back down. So this is why it's important to know the makeup of the patient's room. You might have a patient at home who doesn't have room to move sideways into their bedroom, or maybe they don't have the ability to come straight on. So we have to ask those questions prior to starting the transfer so we know the best way to illustrate. All right, good.